Mental health disparities in the Black communities. How can Blacks be educated on mental health disparities that plague most urban communities? The effects of the unknown triggers amongst Blacks that may encounter mental health illnesses. What are some of the preventive measures that can be taken into consideration? My objective is to discuss some of the key factors of why it's difficult for Blacks in urban communities to receive necessary assistance when it comes to mental health disparities. What are some of the reasons that Blacks stay silent and trying our best to remove the stigma that has kept Black people in bondage for so long when it comes to mental health disparities? There are some whom have encountered the instability of their emotional, physical, mental, and spiritual wellness for not knowing the signs and symptoms of the disease or mental health status, which can alter a person's state of mind, leading to other health concerns. Mental health disparities inside the lives of Blacks living in urban communities, for the most part, was not to be discussed. A few questions that continue to resonate in my mind: how the awareness of mental health disparity among Blacks should be addressed. Why is there a difference in low-income Black families or communicated about mental health services? In the urban communities, Blacks tend to witness various levels of unhealthy situations amongst their families and friends. Due to the misconception of mental health illnesses, it is very imperative that individuals seek assistance and become educated on the signs and symptoms that may cause mental health disparities. We have to realize that mental health disparities and illnesses are real and disabling conditions that are experienced by 1 in 5 Americans. Mental health disparities are affected by the life stressors, physical health, and hypertension that is mainly found in most Black people. The medical dictionary states that mental health is an emotional, behavioral, and social maturity or normality. The absence of a mental or behavioral disorder, a state of psychological well-being in which one has achieved. I had the opportunity to have a discussion about this topic with a young lady by the name of Miss Erica Jones Collins. Ms. Collins has a master's degree in social work and is currently employed with Whitman's Air Force Base, assisting our military men and women when it comes to their mental health status. We both came to the conclusion, while working in a social service field, that for the most part it is best to let the client tell their story, providing them with the necessary means to be empowered. We continue with our conversation on how Blacks are perceived when in the presence of medical professions that are not of the same race. At this time, we come to meet with a challenge in ways of communication about Black people and their health. Ms. Collins shared with me the mentality of Blacks has always been a strong mental, physical, spiritual, and emotional, to the point that they camouflage what the real problem they have, in which they have internalized. Many have felt that they could show no signs of weakness but strength, no matter what the situation is in front of them. At some point, that may have worked, but the way our society is transforming, life stressors of the world can cause the strongest to break. In the mental health, cultural, race, and ethnicity, a report provided by the Surgeon General clearly stated that the mental health is fundamental to overall health and productivity. It is the basis for successful contributions to family, community, and society. Mental health is the wellspring of thinking and communicating skills, learning, resilience, and self-esteem. The fact of the matter that there are some people that ignore the importance of their health until they have to deal with a life-altering situation, and by not researching the necessary resources to educate themselves will definitely cause more harm than good, especially in the urban community across the country. Most Black people tend to lack when it comes to insurance and health care. A quantitative study was conducted by the Stigma of Depression Black American Experiences. In this quantitative focused on a group of black men and women ranging in the age of 21 to 57. They were participants who acknowledged their encounter with bouts of depression at some point in their life. There were other indicators that may contribute: the social economics between blacks and whites. Another study that described the mental disparities between blacks and whites was administered by the Louisville Metropolitan, which blacks and whites were interviewed. The survey simply showed the positivity of how individuals were willing to seek some form of help. Therefore, many blacks grew up accustomed to silencing their need for the mental health resources, which was less likely to seek the necessary help. In the black community's mental health, we share 13.2% of United States population, which identifies as blacks and African Americans. Of those, over 16% had been diagnosed mental illness in the past year, which is over 6.8 million people. While working and compiling and reading different articles, a few questions I found myself asking: what actually happens in a person's life that triggers their behavior to change? When it happens, what made them not want to seek the professional help that they thought or felt like they needed? Were there any signs or symptoms present and the individual just chose to ignore? Why do blacks that may have mental health disparities allow themselves to be silent when it comes to sharing their unhealthy mental status, as well as discussing other forms of health disparities? A few of the mental health disorders that are most prevalent to our society is that of schizophrenia, bipolar disease, depression, and panic disorder. These are just a few, but there are many others that we tend to not give much attention to. Some people are reluctant to get the care they need due to being ostracized or having the label of having a mental health disparity. There is no racial or ethnic group that is exempt from being targeted by any of these disorders. But again, the black community has a tendency to turn a blind eye to each situation. For instance, in Chicago, they wanted to get some understanding of the cultural dynamics in various neighborhoods that had been economically challenged. Many of the neighborhoods that were assessed dealt with individuals who were severely depressed. With depression being one of the key stressors, there was a domino effect in what caused the detrimental factors to a hostile environment. During the devastation of Hurricane Katrina, we see many lives turned upside down. People had been dislocated. People had to start all over. Some people chose to stay in Louisiana while others filtered throughout other neighboring cities and states. During this time, it was just an experience that I personally got to watch through the eyes of the social media and television shows. There are some mental health professionals that were located in neighboring communities willing to assist with educating and setting up outreach programs to aid those that were looking for support. At such a horrific time, the health professionals, along with the support of pastors, were able to educate blacks of the signs and symptoms that may have triggered a mental health disparity. The author of Breaking the Silence on Mental Illnesses in the Black Community, the Stigma and Shame that Blocks Mental Health Treatment in Black Community, she informed us that the Black community's traditional reluctance to discuss mental health and illnesses comes at much too high of a cost. What intrigued me most about Dr. Sarah Vinson, she had created an online mental health outreach program that targeted the Black community. It's a resource tool for patients and individuals inquiring about mental illnesses and too ashamed to speak to someone face to face. Another key factor behind mental health disparities is suicide. The quantitative method that was utilized to help assess mental health illnesses, which stems from the disadvantage of being unemployed, lack of care, and impoverished environments. It can cause a person to spiral out of control with no hope and no reason to continue to live. The possibility of implementing health intervention programs geared toward mental health disparities, designed and taught by Blacks, will offer a slight leverage in helping our Black communities with such a horrific illness. In the African American families, we never discuss depression, anxiety, rape, the family secrets that families never expose, and if they were exposed, it tend to have a downward spiral for the entire family, and the tragic loss of a loved one to violence or a traumatic death. It can definitely change the dynamics of a family structure. Not to mention the stressors African Americans endure on a daily basis, from educational opportunities to unemployment. In conclusion, Health Affairs Journal concluded disparities can be rooted in inequalities in access of good providers, differences in insurance coverage, or discrimination by health professionals in the clinical encounter. Eventually, the impact of quality improvement of disparities will need to review the strategically put as a priority and not just seen as an alternative.